Caroline Beatty, and for my teaching project, I decided to do it on brain tumors. And so a brain tumor is literally just defined as a growth of abnormal cells in your brain. They can either be malignant, meaning cancerous, or benign, which is non-cancerous. A tumor being benign or malignant is just based off of the cell or abnormality level. So, if they're normal, benign, abnormal, they would be malignant. So brain tumors, even though if they are benign, they can still require serious medical treatment, which I'll get into that when I talk about one of the kinds. But less than 1/3 of brain tumors are known as malignant, and there are more than 130 types of brain tumors and CNS tumors, but I'm going to be talking about the four most common, which are metastatic meningioma, glioblastoma, and astrocytoma. And I know I'm butchering those names, but I suck at pronunciation. Before we get into those, I'm going to talk about tumor grading, and that is just a way for healthcare teams and members to communicate more precisely about the tumor and decide on treatment options. And so they can either be grade 1, which are the least malignant. They are associated with long-term survival. They grow slowly and typically look normal under a microscope. Grade 2, they're also slow growing, slightly abnormal under a microscope. If they recur, they can recur as a higher grade tumor. 3, they are malignant. They're not that much different than grade 2, but they are actively reproducing abnormal cells. And grade 4 are the most malignant. They reproduce rapidly. They are very abnormal or odd looking under a microscope. They can easily grow into nearby tissues, and they can form new blood vessels that helps them maintain their rapid growth. So the first kind is metastatic or metastatic. I can't pronounce this, I'm sorry. But they're technically classified as secondary brain tumors, which that just means that they metastasize to the brain and that they originate in at a different part of the body. They tend to they are an important cause of morbidity and mortality. They do have a greater tendency to specifically grow to the brain. Melanoma is one of them. Melanoma is really common for that. Other ones are lung cancer, breast cancer, things like that. A lot of these specific kinds tend to have a lot of the same symptoms: headache, vomiting, seizures, depending on where exactly in the brain they are, the symptoms may differ, but those are the main kinds. The diagnosis are also kind of the same: CT scan, MRI, surgery. PET scan is sometimes necessary depending on the kind. But if the tumor that is being examined is suspected to be metastatic, the treating physician will ask for further testing, which would include a CT scan with intravenous contrast, and that would be your chest, your abdominal region, your pelvis, and the bone. The treatment, chemotherapy, radiation, surgery, those are the most common types of treatment. For large metastatic tumors, surgery is usually the most common, but for smaller ones, you might use a gamma knife, which is just a form of radiation therapy. The next one is meningioma, and that is just tumors that form in your meninges, which are the membranes that surround your brain and your spinal cord. These typically have a reputation of being benign, but the reason that they are included as a brain tumor is because they can squeeze the adjacent brain nerves and the vessels. Symptoms, again, vision changes, headaches, seizures, difficulty walking. The exact same diagnosis: MRI, CT. Usually for meningioma though, so like treatment, like trying to cure it or get rid of it, isn't necessary since they are benign. So usually just surveillance imaging over time is all that is done for these kinds. The next one is astrocytoma, and these originate in the astrocytes. They slightly affect females more than they do males. They slightly affect males more than they do females. So the IDH1 mutation is a fundamental feature of this type that characterizes a subgroup of astrocytomas. In this mutation, it just results in the production of a chemical called 2-HG, which in time builds up in normal astrocytes and they send astray, causing astrocytomas. Grade 1, there's 3 different kinds: pelagic astrocytoma, phyloric xenoexocytoma, I'm sorry for the pronunciation, and subliminal astrocytoma. That's the most common in the younger population. Grade 2 is diffuse astrocytoma. It is an invasive tumor, but there's no clear separation from the surrounding brain. Grade 3 is anaplastic astrocytoma. That's considered more malignant. And then grade 4 is glioblastoma, which is the most malignant, most aggressive form. They result in about 50 to 60% of astrocytomas, and they are usually always malignant and only they do not have a very high prognosis, let's just say that. Persistent headaches, double or blurred vision, speech problems. MRI, you have an axial TI weighted MRI after a gadolinium administration. You have an MRS and an fMRI are the types of tests that are done. Treatment surgery is usually the first type of treatment for astrocytomas, and then the decision whether to do radiation or chemotherapy just depends on the certain grade of astrocytoma. So then the last one is glioblastoma, which is the most lethal. It accounts for 15% of all tumors. They are really aggressive and resist a lot to any of the therapies. They are traditionally divided into primary and secondary. Primary is the IDH wild type. Secondary is the IDH mutant, generally secondary GB. Yeah. Glioblastomas, CT scan, MRI, intraoperative MRI, MRS, and a PET scan. Usually surgery is the principal type of treatment for glioblastomas, and then it is usually always followed by radiation and chemotherapy. And although, it's gonna sound terrible, although the end result is usually to result in survival, usually that only happens for about 20% of patients. I think it's that the survival rate is, after being diagnosed, is 14 to 15 months. So that is a really aggressive type of tumor, and yeah, I'm Caroline Baby, and that is it.